So today let's talk about stroke. Stroke, which is also known as apoplexy or cerebrovascular accident, is another very crucial condition we shall be talking about today, and we must not take for granted. But before we move further, we discussed hypertension the other day, and it is very important for you out there to know that stroke is one of the complications of high blood pressure, which is known as hypertension. So you must be very careful. Now, in the past, we used to know that stroke is for old people. Nowadays, even young people, 25, 30, 20, 40, are suffering from stroke. A lot of them are lying there in the hospitals, paralyzed as a result of stroke. And now it is very important for us to know that there are two types of stroke. Stroke is classified in two categories or two classes. And the first, we can talk about hemorrhagic stroke. Hemorrhagic is related to hemorrhage or bleeding. So hemorrhagic stroke is a type of stroke which comes with the rupture of the blood vessels in your brains. Now, when that rupture happens, there is bleeding, and then the blood that has bled from those vessels get clogged, and there is pressure mounted on the brain, and all of that. There is no more supply of blood and of oxygen, which is supposed to be carried by the blood in other parts of to the other parts of the brain, and then the cells begin to die and the brain is suffering. The same thing will happen when the other type of stroke happens, which is called an ischemic stroke. Now, ischemic stroke is the second type of stroke, which means that the blood vessels that are supplying blood to the brains get either completely or partially blocked. And it's very important for us to know that those things that will block blood vessels could be fat deposits, it could be blood clots, and it could be debris that are flowing with the blood, and then they get to block those vessels that are supplying blood to the brain. And of course, if that happens, there is not enough supply of blood and of course oxygen, which goes with the blood, to have the brain cells live healthy and all of that. So if it happens, the brain cells again begin to die, and then the brain suffers, and then there is a result of what we are talking about today, which is stroke, ladies and gentlemen. So it is very important that we take care of this, and of course it is good to notice the signs and symptoms of a stroke that will most of the times happen suddenly. So if we are with somebody and you begin to see the person's face maybe dropping on one side, the person used to have a very clear face, a bright face, and all the muscles are fixed, are straight, are firm, and it's just all of a sudden you begin to see changes on the face of the person. Maybe the person wants to smile, and then there is a drop on one side of the face. Take note. Don't take that for granted. Look out for other signs. Things like slurred speech. Somebody wants to talk and the speech is no longer clear, very clear again. This kind of things is very important for us to know them. There is impairment, a little bit of impairment in the visual aspect of that person. The sight, the eyes are beginning to get dim a little bit. If the person tells you these kind of things, and you have to take note and be very, very serious about it. If the person is unable to maybe grab something, maybe some of the limbs begin to get weak, you might want to ask them to raise their hands, maybe both hands on the side, that there is paralysis likely to happen. You begin to have weakness of the limbs, and if you ask them to raise their hands, you see that one will be higher than the other one, and he cannot really take up the other one faster or maybe higher like the other one, which is not affected, the other side which is not affected. So it is very important to be fast to call the emergency department for a quick intervention, because as fast as you can provide information about this person for further management or an intervention to take place, the better for that person. And so it is very important that we take quick action. So that's why there's an abbreviation which is called B FAST. B, capital B, E, and FAST, all of them abbreviated. It's an acronym which is used to identify the signs and symptoms of somebody who is about to experience a stroke. So you have to, within a few minutes, you should be able to report the situation and help should come immediately. So BFAST is what the acronym which is used. Yes, so it is very important, ladies and gentlemen, for us to be aware of stroke. Again, one of the complications of hypertension is stroke. Ladies and gentlemen, there are some other things that may result to stroke. Is hereditary sometimes, and some other situations in life. So we must control the way we live our life. We must monitor our health in order that we live healthy